Hello, my name is Dr. Marty Martin, and I'm a faculty member as well as director of the Health Sector Management MBA program at DePaul University in the city of Chicago. What I'd like to focus on today is a topic that is dear to my heart, which is the integration of population health with community health. And the real focal point for today will be to really look at what are the shared roles and responsibilities. So if you are a health services delivery executive, health services delivery chief medical officer or manager, you might be saying to yourself, you know what, we're responsible for individual care, we're responsible maybe for ACO contracts, shared risk contracts, but are we really responsible for community health? And my answer to you is yes, but not by yourself. So let's begin. So when you think about what is community health, I want to give you an example from an initiative in the city of Chicago called Healthy Chicago Priorities. Now, if you think about it, there are a number of different healthcare delivery organizations in the city of Chicago: Northwestern, USC, Rush, a whole host, Mercy, Ascension, a whole host of them. They're important, but what they really focus on is after a diagnosis has been made, then they provide treatment, and then they manage chronic disease, they get involved in rehabilitation, they may do a little bit of screening. But that really doesn't address making Chicago healthy. So look at all the different aspects here about what constitutes Healthy Chicago Priorities. You will note access to health care is just one of them. The rest of these are critically important. So what's your role as healthcare executives? And then what's the shared role and responsibility? Let's take a look at that. So you have a tale of two communities. One is how I would describe is you're on your own. So in this community, individuals have to contend with high rates of violence, food deserts, critical access issues, shortage of healthcare professionals, low employment. So they have to address and deal with a number of issues. I've Got Your Back community is a different type of community. That type of community has both the political support, the environmental and economic support, the socio-cultural support, and the technological support to really make that community excel. So what you need to do as a senior leadership team is to conduct a pest analysis, which is a strategic planning tool. And when you conduct that pest analysis, you'll be able to identify what are particular areas you need to focus on to enhance community health in your community, and what are particular areas where you need to shore up weaknesses or there might be some risks with regard to community health. But remember, you're not doing this alone. You want to take action, but work together. So what do? First step, assess needs and resources. Conduct what I call a community asset map. Pick priorities. Can't do everything. So you may want to look at priorities for those that have the greatest impact on mortality, maybe the greatest impact on morbidity, maybe the greatest impact on cost or utilization. Then you want to, keyword here, find programs and policies that work. So do some benchmarking within your own community or outside your community. Even look for best practices abroad. Then you want to implement strategies, test them out to see whether they're achieving your goals. And that's all part of the evaluation effort. So who should work together? Employers in the business community, healthcare professionals, community leaders, government officials, and public health professionals. Have a coordinated plan. So let's look at the role of a number of different stakeholders who would actually work together. So what's the role of health plans or health insurance companies? So this is just an example from Blue Cross Blue Shield of Texas. So what they have done is they have created some evidence-based policies. And their beginning with regard to their ACOs is to actually use more of a public health approach by thinking in a systems framework. So maybe take a lesson from the health plans. Also within Blue Cross Blue Shield of Texas, they have engaged the charitable community and they're beginning to provide support, ranging from Kaboom, which is an initiative, to caravans, to Casa, which means house. They're also focusing not just on the community, but also individual programs and services as well. Why is this important from a health plan perspective? So if you note here, is fee-for-service is declining, although not at that rapid a rate in most communities. And total cost accountability, fee-for-value, is increasing, maybe not at that rate. But as fee-for-service decreases and total cost accountability increases, it is going to be critical that you learn how to manage the health of populations as well as the health of communities. Because if you can't do that, you're not going to be able to drive down total costs. So now let's look at the role of hospitals and health systems. So most of you are familiar with the triple aim. And as you know, there are three vertices: better care for individuals, and most healthcare delivery organizations are already focused on that. Lower cost through improvement, Lean Six Sigma, cost containment, revenue cycle management, efficiency. So many healthcare organizations are focused on that. But better health for the population, not as focused on that, even if you have an at-risk contract or ACO. So what it also means for better health of the population is not just the individuals that are attributed to you that make up your actuarial population, but also the communities in which they reside. That's the next point where we need to go. Now, the American Hospital Association, they put out a very good document that I would encourage you not only to read, but to study, select some best practices, try it out, and implement it within your organization. A call to action: creating a culture of health. What does culture mean? Culture means the norms, the way we do things around here. What are some examples? A number of years ago, people would drive their cars, not wear their seatbelts, and not think a thing about it. But now the culture has changed. The norm has changed. There's a certain amount of stigma if you don't wear your seatbelts. So people are wearing their seatbelts. That's happened more or less with smoking in the United States, although there are certain populations where that has not happened. So how do you create a culture of health within the populations that you have to manage, including your workforce population, as well as the communities in which your workforce, your patients, and your population that's attributed to your ACO are managed? So what are some recommendations? Number one, serve as a role model of health for the what? The community. The community. So that's where HR needs to get involved with the Director of Community Health, maybe the Director of Community Benefits, the Chief Medical Officer, the Director of Quality, the Director of Environmental Services, of Security, and really develop a comprehensive plan. Again, serve as a role model of health for the community. And why is that important? If you look at the continuum of care, we see healthy, and that is the focus of community health, all the way there to complex, quaternary care. So the challenge now for healthcare organizations is how to attend to complex, chronic, at risk, and healthy. The day of only focusing on complex or chronic is over. And if you have an at-risk contract, then it behooves you to really focus along the whole, not just care continuum, but what I would call continuum. Because part of community health is you never want people actually to receive care, because that is a failure to some degree. So now let's look at ACO structure within AHO. And some people are saying, hey, Marty, what's an AHO? An AHO is an accountable health organization. So that's not written within the language of PPACA or the Affordable Care Act, but think about it. Accountable care organization, traditional population health management. No, you're going to go one step further. An accountable health organization, which subsumes, embedded within that, is an ACO. That ought to be the focal point, an AHO. I believe that many progressive health plans have been thinking along that way for a number of years. So what's the possible structure for an ACO? So this really is a developmental model, if you will. Level 1 is kind of what we're doing right now. Level 2, beginning to move in that direction. Level 3, some of the leading edge ACOs are moving in that direction. Level 4, in my mind, I would kind of scratch out ACO and put AHO. That ought to be your strategic target. It's understandable that you're not there now, but in your strategic plan, are you moving towards level 4? And if you're not, what are the risks? And even if it turns out that a lot of these capitated global payment ACO contracts do not turn out to be what we imagine them to be, then who's going to fault you for improving the health of the community? Now let's look at the role of public health organizations. So this just shows one example from one public health department in a suburb of Washington, D.C., Prince George's County. Now, some of you may be familiar with Prince George's County, some of you may not. It sits on the right outside of Washington, D.C., several pockets. It has some pockets of affluence, but also some pockets of kind of deeply entrenched poverty. What they have begun to do is look at community stakeholders, primary care providers, hospitals and health systems, as well as the public health department. So what they're seeking to do is really develop a partnership that really focuses on that care continuum. So we have wellness, we have at risk, we have chronic, and we also have complex. What's the role of business, big and small? And I really think that business needs to play a role, not just in terms of employer incentives, but also making sure of looking at wages, because wages and working conditions have a huge impact on health. Some of you may have read the book The Jungle when you were in college by Rudyard Kipling, and he profiled what happened in the Chicago stockyard plants. Those were unpleasant places and definitely impacted individual health, family health, and community health. So let's kind of take a quiz, if you will. So if you note here, I have employed, underemployed, and unemployed. So who experiences twice the rate of depression and 3 times the rate of anxiety than the general population? Unemployed. Who experiences increased rates of obesity? Unemployed. Who experiences reduced rates of activity? Unemployed. Who experiences increased cardiovascular morbidity and mortality, death? Unemployed. So from my perspective, employment, living wages is not just a political issue, not just an ideological issue. It is, and even far beyond an economic issue, it is a health issue. So let me read this with you, and hopefully it triggers you to think about broader notions and concepts as to what drives community health, because that's going to drive population health and fundamentally impact your measures at a healthcare organization. We know what makes us ill. When we are ill, we are told that it's you who will heal us. When we come to you, our rags are torn off, and you listen all over our naked body as to the cause of our illness. One glance at our rags would tell you more. It is the same cause that wears us out, our bodies and our clothes. It is the individual, but it's also beyond the individual. So for a moment, let's think about the role of wellness, whether the wellness in the schools, wellness in the workplaces, wellness in your particular hospital or healthcare organizations. They're becoming increasingly common from small, mid-sized to large organizations. The top goal, and I was quite delighted to find this out, is to improve employee health. Now there are some, healthcare cost benefits, productivity benefits, but that wasn't the main driver. So what's the main driver of your population health initiative? What's the main driver of your community health initiative? It's okay to have costs there. It's okay to have margin improvement there. It's okay to have compliance there, but is that the main driver? Let's look at a wellness strategy. So the conventional view versus a more strategic approach. So I'm going to focus on the strategic approach. So here is you actually view your employees as an asset, not as a liability. You also design your programs in a way that are population specific. So maybe some travel a lot, different intervention. Maybe some are the night shift, different intervention. Maybe some work in one part of the state or city, different intervention. Some of a certain age, different intervention. Some have different risk factors. And then in terms of your programming, it's tailored and it's customized. You also tie the cost maybe to your health insurance plan, and you look at more robust outcome measurements. And you also look at it from the point of view of integrating it with your disability management point of view. If I were to read your strategic plan for your organization, how many times, if I did a word search, would I see community health and not under community benefits, Form 990? And how many times would I see employee wellness and not just for retention purposes? So last, what's the role of government? So truth is stranger than fiction. So kind of take a look at some of these signs. So clearly government has a role, not the role. But there is an ideological divide. So liberals and conservatives look at things from a bit different point of view. In general, the liberal orientation is to look at the individual within a context. In general, the conservative point of view is to only or primarily look at the individual. You need to look at both. Now let's look at what's happening within the state of Vermont as it relates to patient-centered medical homes. This is their blueprint model. In their blueprint model, what you will note is they have a community care team. So who's on that team? The usual suspects: nurse coordinator, social worker, dietitian. What's different? Community health workers. So community health workers have been around for years, but within the ACA, they've become more professionalized. Are you educating and training and hiring and supporting and implementing community health workers in your organization? So greatness is not a function of circumstance. Greatness is largely a matter of conscious choice and discipline. So do you choose to embed and integrate community health within your population health initiatives? If you do, I'm pretty certain you will see benefits. If you choose not to, when? Thank you very much, and we'll continue this discussion with some subsequent modules on why community health must be integrated with your population health strategy.